When you come to Atlantic Foot and Ankle Specialist to be measured for diabetic shoes, we put you through a comprehensive diabetic foot exam. And what that exam consists of is we check range of motion, we check sensation, we check gait. We look at the way that you walk to make sure that your gait is within a normal range. We also look for calluses, hot spots, so on and so forth, to make sure that when we put you in a diabetic shoe, we put you in the proper shoe with the proper inserts that's going to reduce the chances of you ever developing that callus or that ulcer, which can ultimately lead to an amputation. In addition to the diabetic comprehensive foot exam, we also recommend that you come see your healthcare professional every 2.5 months to have your diabetic nails trimmed. The reason that we recommend that you have your diabetic nails trimmed by a healthcare professional is because of the sheer nature of diabetes. Diabetes attacks the circulatory system, which ultimately affects the sensation in the lower extremities. With that loss of sensation, if you trim your own nails and you nick yourself, that can open you up for a chance for an infection. That infection can lead to bigger problems. So we suggest that you see your healthcare professional every 2.5 months to have your nails trimmed. Vascular studies are used to determine how well your blood is traveling from the heart to the lower extremities. If we find that you have poor circulation to the lower extremities, this is a key indication to us that there may be something going on in the heart or the brain. When this is determined, we will refer you out to a vascular surgeon. Vascular studies are great for our diabetic patients because it gives us a baseline with that first test that we can monitor each year with an annual test to follow that. Diabetic shoe versus a regular over-the-counter shoe. The diabetic shoe differs from a regular over-the-counter shoe in 3 major ways. 1, the diabetic shoe is an extra depth shoe. This extra depth gives you more stability and more ground surface. 2, the diabetic shoe comes with a thicker sole. The thicker sole protects the foot from the elements of the earth or stepping on anything sharp. And 3, the diabetic shoe comes with a seamless insole. This seamless insole protects the foot from any shearing force that could cause an ulcer and ultimately lead to an infection. So as you can see, between the comprehensive diabetic foot exam, the yearly vascular studies, the diabetic nail care, and the diabetic shoes, we at Atlantic Foot and Ankle Specialists go to great lengths to make sure that our diabetic patients live a happy, healthy, and prosperous life.